Go.
Hello, my name is Stella Nichols, and today I'm going to be talking to you about obesity. The United States is currently experiencing an obesity epidemic, with 1/3, or a staggering 76.8 million of the population considered obese. According to the Centers for Disease Control and Prevention 2008, $1,500 was spent on obese patients more each year than that of non-obese patients. And in 2013, the American Medical Association finally recognized obesity as a disease. Research shows that obese patients are stigmatized in healthcare because of provider attitudes and the patient's perception of differential treatment. Today we'll be looking at some studies of healthcare provider attitudes that may include weight bias and stigma, and also studies where patients perceive differential treatment due to their size. So let's take a look at this bar graph. I have entitled it, Physicians' Attitudes Regarding Management of the Obese Patient. It includes information from a cross-sectional study entitled Family Physicians' Practice and Attitudes Regarding Healthcare of Extremely Obese Patients. The research was the work of Fiorente, Piasecki, Ullman, Strickland, and Crabtree in 2009. The data collection method used was mailed questionnaires which were sent to 500 New Jersey family practice physicians. The response rate was 53%, equating to a mean of 255. Extremely obese refers to patients who have a body mass index of, or BMI, of 40 or greater. The graph represents the effect of physician attitudes towards management of obesity in extremely obese patients. As you will see on the x-axis, there are 7 bars depicting 7 questions asked by the researchers and the responses measured in percent. On the y-axis shows the mean of 255 respondents. To the right you will see the legend. And the question with the highest response was patients' lack of discipline to lose weight with a score of 78%, followed by patients wanting an easy way out at 71%, then frustration dealing with weight loss and obesity at 66%, denial of poor eating habits at 54%, no motivation to lose weight with 52%, treatment for obesity is often ineffective, scored 51%, and finally physicians' pessimism about the patient's ability to lose weight at 34%. The study found there was a higher prevalence of negative attitude in younger physicians with smaller practices. It also revealed that those who had a higher knowledge of weight loss treatments were less frustrated in dealing with obesity issues. It highlighted the need for more education regarding community resources, surgical and non-surgical treatment options. I'm now going to talk further about healthcare provider attitudes. So how do healthcare provider attitudes affect patients? According to Heisinger, Cooper, Blight, Clark, and Beach in 2009, studies show that physicians have higher respect for patients who have a lower BMI, and that they tended to have less empathy and bonding with patients with a higher BMI. Women also stated that there was more stigma for them at a BMI of 27 than men who had a BMI of 35, which is considered obese. In a study by Puel and Hewer in 2009, nurses with lower BMIs themselves have increased negative attitudes and perceptions of obesity, and the 2006 study showed that nurses' attitudes were consistently biased with stereotypical responses that obese patients were lazy, non-compliant, and lack self-control. According to the Guthrie Clinic in 2015, bias can also include not having the right size gowns, blood pressure cuffs, scales, and furniture to meet the needs of the obese patient. And unfortunately, in some cases, obese patients have been turned away from second appointments after their first one due to their size. So how do patients perceive differential treatment related to size? A study by Bluestein, Blight, Richards, Weiner, Hodges, and Clark in 2013 said that negative interactions cause patients to doctor shop. This provides inconsistency of care and increases patients visits to emergency rooms and urgent cares and walk-in clinics for routine medical issues. Patients prefer the anonymity of these types of healthcare settings over regular physicians who they feel show them disrespect. According to Wadden, Anderson, Foster, Bennett, Steinberg, and Sower in 2000, a 1994 study showed that 78% of severely obese women often delayed treatment or visits to their physician's offices due to their feelings of lack of respect for them at their physician's offices. And finally, another study by Hebel, Zhu, and Mason in 2013 revealed that overweight males were likely to have 8 minutes less consultation time than a non-overweight male when they went to visit their physician. This seems pretty ironic, seeing the obese male is probably going to have more health issues and is higher risk and may have more comorbid conditions than a non-overweight male. So in summary, obese patients are stigmatized in healthcare because of provider attitudes and the patient's perception of differential treatment. Some healthcare providers' attitudes do include weight bias and stigma, and patients do perceive differential treatment due to their size. In closing, the huge gap between obesity awareness and patient care needs to be addressed by educating healthcare providers on obesity sensitivity and recognition of the disease. Patients strongly need to be encouraged to step up and become better advocates for themselves in regards to healthcare reform and the treatment of their disease.